everyone. Welcome on behalf of RIC. This is yet another NextGenGov dialogue series, and we have some really amazing champion women leaders with us. Uh, when was the last time you really participated in a webinar which had a minister and a bureaucrat together talking about innovation? That happens with us at innovation team here in Bangkok Regional Hub. I'd really like to welcome Honorable Minister Health from Kerala State, Madam Shailaja Teacher. She needs no introduction to the development sector. She's almost a celebrity for all of us. We've been looking at what's happening in Kerala, the work that has been happening, the rise, the fall, the lessons, the successes. We totally look forward to hearing you, ma'am. And we are also joined by Dr. Fazilah Sheikh Allaudin. She's also another woman government innovation champion from Malaysia, speaks a lot about disruption, future of digital healthcare. And we have our very own dear moderator, Milika Bejovic. We call her Millie, who is the Global Innovation Advisor. I really leave the floor over to you, Millie.
Super, thank you, Aafreen, so much. I'm very privileged to be on a call with Fazilah and with Madame Minister. As Aafreen said, neither one of you really need a lot of introduction, because we've been, at minimum, those of us who don't work in the region have been following the news and been reading stories about the response and recovery efforts as both of your Kerala and Malaysia are going through the virus. And I think from the perspective of our work, just from cursory reading of the paper, there are some commonalities that emerge from your initiatives, from the response of both places to COVID-19. One, it seems that in both cases you have had experience in dealing with crises that no one has seen before. Crises where there has been no playbook to deal with, like Nipah virus in Malaysia. So you have kind of already gone through the painful process of working out what happens when you're thrown in the context of radical uncertainty. Two, you have had experience with pooling whole of society to address some of these issues. Especially in the case of Kerala, there's a very strong sense that governance in crisis does not come from thin air. It's something that results from compounding investment into the society and into the infrastructure such as health and education, and something that Aafreen has given me a very clear brief to focus on. The leadership behind these initiatives really comes from women. And there is much that has been made about this female leadership from New Zealand, from Germany, from Finland, and a few other places. So maybe as a first question to start us off is, seeing as though how COVID-19 has been an eye-opener for the world, really, but specifically governments to assess their readiness to handle shocks and quickly learn to recalibrate policies. Could you tell us a little bit from your perspective, as women policymakers, what kind of lessons of governance have you taken from these first 6 months of dealing with COVID? And maybe, Madam Minister, we can start with you.
Mr. Me? Okay. Yes, the COVID-19 has been a litmus test for the governance systems throughout the world. The whole world is struggling to contain this virus and to tackle the problem. And we learn from each other's best practices and mistakes. And we should compare, or we should discuss about different kinds of governance and the investment in the health sector, etc. And the whole world is discussing about that. I think in Kerala we have a centralized planning and decentralized activities, implementation of the decentralized manner in Kerala. And also the health system in Kerala is being tested for this kind of decentralized activities for several years. Throughout the years, we were improving the public health system more than anything. And in Kerala, you can see that in each and every panchayat, that is the lower level local self-government, and in each and every panchayat, we have a primary health center. And the next level, in taluk level, we have taluk hospitals, and in district level, we have district hospitals, and we have medical colleges under the government sector. And the private sector is also here, and 50% or more private sector is working here. And we have a collaboration between this private sector and government sector. Means we are controlling the private sector. We have a very good act. We passed a very good act last before 2 years, the Clinical Establishment Act, and through which we have some restrictions and some management to the private sector also. But we are improving the government sector for the poor people. We are investing more money to the government sector. Actually, our country is investing a small amount, like all other countries in the world. That is not sufficient. And throughout the country, we are working hard to improve this public sector. But in Kerala, we are doing more thing by the decentralization and with the people-centered method. We are improving this thing. From 1957 onwards, it is in 1957 that the linguistic states are formed. The states are formed in India after the independence. 1947 was our independence year, and after that we have states according to the language, and Kerala also Malayalam speaking people in Kerala, and we had our first election democratic way in 1957, and the state is formed here. From the very first government, we have some revolutionary act in Kerala legislature. One is according to the land ownership, for the land ownership. At first day itself, we thought about giving stay to the eviction by the landlords. And after that, we have land reform acts in Kerala. And through that, most of the people in Kerala, more than 95% of people in Kerala have their own lands, 5 cents, 30 cents, or 1 acre, or like that. And we passed the Surplus Land Act also, and only 15 acres land, one ownership for one person, individual, and all other surplus land we take over and distributed to the poor people. And the poor people become landowners here. And we have some projects for building houses for them. And now also we have a project called a mission called Life, to build houses for the homeless people. And that way we are restricting the slum formation in urban area, etc. And the poor people have a piece of land. And the same way we have so many revolutionary acts on education reform and also health reform. This government came to power in 2016 when I became the health minister. And this government declared 4 important missions. One is known as Harita Kerala mission. It is for the organic cultivation and preservation of drinking water, and also the waste management. And that is going on well. And the other mission is for the building houses for the homeless, means Life mission. And the other thing, the third mission is on this education reform sector, and we are building our schools as high-tech and smart classrooms. We are building them according to the new era. We are implementing the IT plan in the schools, and also we are converting the classrooms to smart classrooms. And the last mission, this fourth mission, is Ardhra mission. It is under the health department. And we, through the Ardhra mission, we try to change the basic structure of the public health system. The first part is we should have to give more focus on prevention, and that is in the primary sector. Earlier we have primary hospitals in Panchayat, but only one doctor was there, and also the function is up to noon. No laboratories like that, only a small hospital with one doctor and 2 or 3 staffs, no laboratories, no other activities. And through this mission, we decided to change that. We are now converting the primary health center to family health center. Family health center, we provided 3 doctors in the Panchayat, local, the lower level. And up to 2 to 6 also the outpatient sector is there now. And we constructed very good laboratories in the primary sector itself, modern laboratories. And the poor people in the village, they can directly go to their family health center and check their non-communicable diseases, etc. Everything they can check in their primary health center in the panchayat. And the infrastructure also changed. We insisted that it should be people-centered or people-friendly. And there should be a very good garden outside of the hospital, and inside the entrance, we should have a very good reception with airport chairs and very good LED projections in the wall, etc. Very good toilets for men, women, and differently abled, etc. And we insisted each and every minute things, and we are building like that. Now we converted more than 600 primary health centers to family health centers. We have 941 primary health centers in the state, and this year we will complete everything. And Taluk Hospital also we made some improvement and very good casualty, and we converted our casualty to emergency medical unit with very good trial system, etc. I'm not explaining everything, very good theaters, etc. And we decentralized the 3 important super specialties, that cardiology, nephrology, and neurology, to district level. And we supplied cath labs to district hospitals. Previously, it was in the medical college only. And we distributed cath labs and installed cath labs in the district hospital also. And we are improving our medical colleges to center of excellence, constructing modular theaters and supplying the most modern equipments for imaging and for operation theater, etc. We are providing the modern equipments like new types of Linac machine and also the MRI scanner and CT scanner. Everything we are providing. That way we are improving the primary system. Not only improving the infrastructure, but also the clinical practices also should be improved. And in the primary sector, we started a SWAS clinic in the primary sector to check COPDs, chronic obstructive pulmonary diseases. And also some ASHWAS clinic to check the depression and mental condition of the poor people in the grassroots level. That kind of thing also started here. But the money is the major problem, you know. Kerala is not a very rich state. We have only, our income is nothing but the share given by the central government as the plan fund from the taxes share, etc. And we have no extra revenue income in Kerala. But we are managing by the decentralized method and people's planning. In the grassroots level, the rich people are helping and some companies are helping. It is not 100%, you know. We are prompting them. Then now, within the last 3 or 4 years, there is an improvement that more people are coming out to help the hospitals to invest their this corporate fund, this fund to CSR fund, or that some responsibility fund is there with them, and a share of their profit they are giving. When we made a call to help the government to improve the system, the people are helping. The rich people in the village or town are helping to improve their hospitals, and that is in a not in a large scale. It just started, and government also is distributing its money in a people-centered manner, and they are giving more money to health sector now to implement this mission, etc. And this helped very much in the COVID-19 situation. And in the grassroots level itself, we can check the people for ILI, SARI, etc. The influenza-like illness and the severe acute respiratory infection, we are checking in the private level itself. That's a very good help to us. And when the COVID-19 started, our early preparedness helped us very much. When we heard about this potential virus, there is, I think WHO declared in January 18th or like that, that there is a potential virus in Wuhan, it is spreading there. We started our preparation here. And I called my health secretary and we had a very good meeting at that time. And we discussed that There are so many Malayali students in Wuhan. They are studying for medicine. Malayalis are, Keralites are everywhere in the world, seeking jobs and also for business, etc. They are going to every part of the world, and the expatriates are a large number in Kerala. And we thought that they will come back from Wuhan, and the virus also come with them. And we prepared for that here. We trained some peoples, and we asked them to have a help desk in airport to check the people whenever they are coming back. And we started our control room here, and 18 expert groups were formed for different activities, for logistic collection and collection of medicine, and also contact tracing, etc., for isolation, etc. We formed 18 expert groups in state level and 13 expert groups in district level. All the district we asked to form their control room there under the leadership of our district medical officer and district surveillance officer. And we started our work at that time. And that helped us also. And when some people returned from Wuhan, at once we caught them from the airport itself, and the symptomatic people, we started to trace them, and we take them directly to the hospital, and the other persons to home, and we insisted home quarantine here. We applied, actually we applied 4 strategies to contain this virus in the previous days itself. One is the according to the potential of the virus, and our strategy is related to the potential sources of infection. And we declared a strategy called trace, quarantine, test, isolate, and treat. First thing was tracing, and second thing was putting them to quarantine and testing them when symptoms occurred, and also moving them to hospital and isolate and giving them proper treatment. We set our protocols and standard operating procedures properly. We looked throughout the world literature and everything, and we discussed that things together here, and we set our own protocols and our own standard operating procedures, basing these things. So WHOs and ICMRs and UNs, every declaration we go through thoroughly and took something from it, and under that base we prepare our protocols according to Kerala situation. And the second strategy is to break the chain of spreading. We have 2 intentions. First one is to break the chain and reduce the transmission rate, and the second thing is the reduce to mortality rate. And for reducing the transmission rate, we started a campaign called Break the Chain. And under this synonym, this SMS. S means soap or sanitizer, M for wearing mask, and that the final S for social distance, keeping the distance, and wearing mask, using sanitizer, and keeping 2 meters away from other person. We started our campaign. I think 80% of our population is now, more than 80%, they obey these things, and the other 20% we have to persuade them, we should compel them, we should take action against them. We are taking action against the person who are not wearing mask and who are breaking this protocol, COVID-19 protocol, etc. And our third strategy is how to break the chain to the elderly people, the most vulnerable people. We should have to restrict, or we should have to cut the chain of the transmission to the elderly or to the vulnerable. The elderly, and also to the pregnant woman and children below 10 years, etc., are most vulnerable to this virus, and we have to protect them. And we started a program called reverse quarantine and grand care program, especially for these vulnerable people. We distributed all the NCD medicines. The people are taking non-communicable disease medicine. As you know, Kerala has so many good things, and along with we have some first places for the bad things also. That is because of the lifestyle, our people are suffering by NCDs, sugar, this diabetes, and this cancer and thyroid, high blood pressure, etc. rampant in Kerala. Kerala is known as the diabetic capital of India, you know, and that is the challenge in front of this COVID-19 situation. And we supplied the non-communicable disease medicine for diabetic and for hypertension, everything. We distributed the medicine to the doorsteps. Our volunteers supplied this medicine in the houses and asked them not come outside the houses. And we are keeping the elderly inside the house for more than 6 months, you know, 6 or 7 months. They have some frustrations, etc. We are giving mental this counseling, etc. for reducing the mental stress, etc. That's a difficult task, keeping the elderly inside the home. It is a difficult task, you know. But anyway, we are managing, and that way we are reducing the mortality rate. The other thing is the social immunity, creating the social immunity to educate people about the immunity. And we are now preparing to face the major problem, you know. When the lockdown declared here in March 24, our central government declared a complete lockdown. From outside now people are coming at that time. Then at that time we can manage our health system properly, and our aim is to make the the raising of the virus or the raising the hike in the graph below the health system resilience. And at that time we can strengthen our health system during that lockdown period, and the graph become flattened. And the first phase, we flattened the curve to 0 level, you know. That time, whole world look at us and they asked, how did you flatten the curve? And we explained our method to them. At that time also, I said that when the lockdown is lifted once, at that time, the expatriates again started coming to Kerala. And at the same time, not only outside, but in India, some states caught this virus and the spreading become very large in our neighbor state, Tamil Nadu and Karnataka, etc. And there are so many Keralites there also. And when after May 4th, again the lockdown lifted and the old expatriates start to coming back to Kerala. And we anticipated that at that time, definitely the graph will show again a hike. And
Yes.
it happened here. More than 6 lakhs of people returned to Kerala this time. And
More than how many?
6 lakhs. Because more than 11 lakhs of people are outside from Kerala. They are working in different countries and different places. And more than 6 lakhs returned back. And the virus is with them. And we try to trace them in the airport itself and the checkpost, etc. But in the border, from the border of other state, neighbor state, they are coming by village paths without our attention. They are coming at night, coming to their relatives' house and staying there and going back after that next day. And we only, yes, that is a great problem to us.
Yes. So, Madam Minister, I think one thing that really strikes me as I listen to you is how much investment there has been in some of the critical infrastructures that exist in the society, from making sure that the poor and the homeless have housing, to investment in education, to investment in various forms of communication and building relationship with citizens, not to mention the infrastructure in health. It really points, if we look at the philosophy of what NextGenGov is, we are sort of looking at where are the emerging signals of governing, not just in emergencies, but setting up the society to really be resilient in facing COVID-like shocks. So this has been absolutely incredible to hear the story behind the headlines. I will turn to Malaysia now, and Fazilah, I'm curious from your perspective. First of all, I would love to hear what is the situation with the COVID-19 now in Malaysia? How has it changed over the last couple of months? And maybe some reflections from you on the lessons in governing in the context of kind of long emergencies, especially as a woman policymaker.
Thanks, Millie. It's great to be together with Madam Minister today. But since Madam has mentioned the key strategies, which actually is similar to what is happening in Malaysia or Kerala or many parts of the world. So I was thinking that perhaps I would like to take from the gender lens, So interestingly, as you mentioned earlier, countries led by women particularly is successful. For example, like Kerala by our Madam Minister, New Zealand, Germany, Finland. But in Malaysia, it has been led at the forefront by the Director General, the Senior Minister, and the Prime Minister, who are actually all men. But thankfully, we have done well. I think perhaps because they are willing to listen to women advisors, I would think so. And actually in Ministry of Health, we are supported by teams of public health experts, researchers, and policymakers who are majority women. So I'm looking from a women leadership perspective. You see, on the whole, I think the pandemic is not just public health crisis. It is also economic crisis. It's also a social crisis. And women seem to be handling this well. I think because women, we are good in multitasking. We are good in balancing. We are better in dealing with uncertainties. That is what the pandemic is all about. Uncertainties. Higher emotional intelligence. I think that's very important in this crisis. Women can be very firm and fierce in senior leadership, but at the same time, I think we are gentle, we are graceful, we are compassionate. I think because of the nurturing nature. So I think this COVID has actually challenged the perception of what a strong leadership looks like. But I'm not going to go further in terms of the public health interventions or the preparedness because a lot of things has been mentioned by the Madam Minister. But I think I would like to add few more important key points which I've witnessed in managing COVID in Malaysia. The multi-channel communication that we use for public and community engagement. I think that's very important. Our daily briefings and which is transparent, which is factual, which is consistent. Evidence-based strategies, definitely, from surveillance to diagnostic to testing, isolation and treatment. And I think this is the same in any parts of the world. Agility in development of policy and guidelines. As mentioned by Madam earlier, all countries have guidelines. In fact, for the last six months, I think we have gone into 6 versions of our guideline for the national guideline. So that shows how fast things are moving, And of course, the use of digital technology is very important, data and analytics. Whole of government, whole of a society, it's there, and that's how Malaysia is combating this pandemic. And we do a lot of regional and international cooperation. So far we have been handling it quite well. And but lately there's been again a rise and spikes in cases, but it's mainly in clusters of in certain states. So what we have gone back to lockdowns for only targeted areas. But we have eased the lockdown. The economy is back back in action. Mostly all sectors are open now. So that's where it is today in Malaysia. But in terms of public health intervention, it's the same as mentioned earlier.
Fantastic. Thank you so much for that response. Madam Minister, maybe a question for you. One thing that continually comes up in discussions about, for example, your response of Kerala is, what are the factors that have led to such high degree of trust that citizens in the society have in the state's ability to respond and to deal with a crisis like COVID?
Pardon?
What are some factors that you can point out to on how come there is such a high degree of trust between society and the state, and trust of society in state's ability to respond to a COVID-like event?
Yes, we have to live with COVID, but the people are stressed in many ways, Someone lost their job, And there are when the family members are together for a long hour, I think as Madam Dr. Fazilah Shaik said, women are suffering also. Not women, in one part women become the leadership to contain this COVID-19, and the other part the most of the women are suffering inside the home, but they are living long time with the family. They have to assist the elderly, and their sometimes because of the patriarchal society, they have to assist their husbands and their children in a long time in the family, and restlessness happened there. Even the these atrocities are also happening in some places. Also, we have to tackle all these problems, and all the men and women and children are in a stress. Children cannot go to school, and they are getting the online classes here, and they are not. It is not sufficient for sharing their emotions and feelings with others, and that is the situation here. But in health sector, we collected all the counselors together and give them good training, and we distributed through the mental health program district wise and also in the local level. We are giving counseling to the whole family in our country. It is a difficult task, but we are doing it. And each and every people who are in quarantine, in home quarantine, our peoples are calling them each and every day. Morning and evening, we are calling them and asking what is their problem. They are sharing their emotions and feelings to the our counselors, and that way we are tackling that problem in one side. The other side, the economy is going down, and as Dr. Fazilah said, everything is open to save the economy of the country and also state. We have to give some restrictions, but we have to open some way for the to tackle that financial problem also. At that time also, the stress again become increased. People want to go outside, but when they go outside, they become stressed on the fear of this COVID-19. And in each and every companies and workplace, we are giving them counseling and proper guidance how we can live with this virus. And we are teaching the people to that. And slowly we are opening everything. And at the same time, we are strengthening the health system to tackle the problem. When the number become high, we have to adopt or admit them to our hospitals, and we are building more CFLTCs, COVID first line treatment centers, other than the existing hospitals and COVID care centers, etc. And recruiting the volunteers and recruiting the health staff there and giving training. And that way we are tackling the mental stress and the stress in the community, etc. And we have to balance these two acts. In one part, we have to protect the livelihood. The other part, we have to protect the life. The ultimate aim is to protect the life, and in the end, everyone will ask us what is the net result and how many lives you can save from out of Corona. That will be the ultimate question or last question when we come out of this COVID-19 fearness. And we have to save more life. That is we are going on.
Thank you so much for that answer. I think I was going for the trust question, but we talked about stress aspects, and I think it really does point out to this whole of government response that Kerala has had, that seems to have contributed to a more effective way of responding, but also effective way of flattening the curve. Maybe Fazilah, a question for you. You have led the effort on digital transformation of the health systems. What are some of the key factors that make that type of transformation successful, especially speaking from the perspective of being in the middle of responding to the crisis as well?
The pandemic actually has accelerated the use of technology in a very short span of time. And I think this is an opportunity to actually accelerate digital transformation. For the last 6 months, system implementation, solutions, technologies, they were going live at a record speed. And we were doing many things that was not possible before. And at the same time, the collaboration between public sector, private sector, industry, it was just amazing, fascinating. But I think what worries me actually is actually how much of this are we able to continue and practice? How long can we sustain this model? And can we move in this speed post-COVID? And will we fall back to being silos and fragmented? So these are some of the questions that is lingering in the mind. But I think to move forward, we have to address all the challenges. And I usually will go, challenges in people, process, technology, policy. There are many challenges. Deployment, funding, digital leadership, change management. But post-pandemic, I think we have to find a new business model, a new way of maintaining this, enhance strategic partnerships like how we saw during the COVID. And also, I think investment in human capital is very important. And as we move forward, I'm also, we're already witnessing new technologies, AI, robotics, augmented reality. But all this, I think, are bringing their own set of safety issues, ethical issues, legal issues. So these are other things that needs to be addressed. We have to review some policy and regulation, definitely. Spur innovation, and also build an ecosystem, that is enabling. And not forgetting the future workforce, their skills, the knowledge, the expertise is very important. And I think whatever it is, the most important will be is to improve our customer and or our patients' experience. And of course, finally, I really hope that when we are looking into digital transformation, and also in COVID-19, we are starting to look at the digital divide has become more apparent. And I think closing this gap is now more urgent than ever. So we need to ensure there is digital connectivity. Broadband should be, it's like any other utility. There must be digital trust, digital literacy among the society, So these are all few things that I think is important in post-pandemic area, really.
Maybe just a quick follow-up. Could you tell us a little bit how does that digital gap manifested itself throughout the pandemic? And also, so this is one, and the second one is, how has your relationship with the tech ecosystem in the country, startup, citizen-driven organization in the realm of technology changed during the pandemic?
During the pandemic, like I've mentioned earlier, the relationship has been great. In fact, it's the public, private, and the industry working together in addressing, some of the solutions. We have had a few solutions that we are doing with industry partners. So, but last 1 or 2 years, I think Malaysia is also moving towards becoming advocating innovation. So there are a lot of programs for startups, for SMEs, and also a lot of hackathons is happening right now, and also innovation from ideation to go to market. So the entire process roadmap is also being created by many agencies. I think there's also a review in terms of science, technology, and innovation policy. That will be another one that will bring the country forward. But in terms of digital, when I'm talking about digital divide or gap, we are using a lot of technology in this pandemic, for contact tracing, for check-ins and all that. But what about smartphones and broadband in rural areas? It is still very low. Broadband penetration and also smartphone, I think there is only about 70 to 80%. So that is another thing. So these are the gaps that needs to be addressed. And now everything is online, especially education. What about kids in the rural areas? So I think this is more an urgent now to address and to close this gap as we move forward.
Thank you so much. That's really interesting. Now, you know, we don't have a lot of time, so I would like to end with the question that would kind of pick your brain and your expertise about the future of governance. So, looking from where we are right now, what does the future of governance look like to you? And what I mean by that is, if you were building policies for the future, where you would make the state of Kerala or Malaysia more resilient in face of COVID-like shocks, what types of policies would you be building right now?
Yes, so I think the COVID-19 give us some opportunities also. And as Dr. Fazilah said, in the IT sector and the artificial intelligence, etc., there are some interventions are happening in among the society, and we should have to accept that things also, and should have to improve our technology, and that kind of development should be happen, because the analysis of data and the administration, etc., we realize that we should have to adopt the new technology in our governance. And we had already started the e-health project here previously before the pandemic season, and that we have to strengthen more in Kerala. And we are doing like that to electronic system in each and every part, even in the village itself. We are doing that e-health project. We want to move that e-health project. Some interventions also happening here. It is interesting that the engineering college students and medical college students invented some kind of robots, etc., for the treatment of the COVID positive patients, and we are using that robots in our COVID hospitals now itself, and some kiosks to take the nasopharyngeal swab, and that some model that is the model in South Korea also. They had a model of this kind of kiosk to took the samples easily without any transmission, and that we are trying in Kerala also like that. And we know that the investment should be more in health sector, and we should have to improve the health system further to accept more recent things, and also the technologically fit thing to tackle this problem. And how the investment, how can we get the money we are looking for. And in Kerala, fortunately, our government, our chief minister and our finance minister started a new method called Kerala Infrastructure Fund Board. That is a long-term loan from the authorities like Asian Development Banks or like that. And from that, we are getting a major share for health sector now because of this pandemic. They are ready to give a major share to health sector. And with that money, one part we are tackling the COVID-19, and the other part we are intentionally improving our health system here. And the other support systems also, our government is implementing other social welfare schemes. Our chief minister declared 20,000 crores project for the COVID-19, and we are giving free food to the prepared food to community kitchen. Through community kitchen, we are serving foods, and we are giving social security pensions for the poor to make them earning, and that kind of activities are also going. In the end, I want to say that the system, it is the most important thing. What is the method we are adopting for the governance? It should be people-centered. It should be egalitarian, and it should be social. That is the most important thing. And we should have to give equal opportunities to all the citizens, and to improve their lives equally. And that is the lesson we learned from the pandemic. And the future days, we want to improve our systems like this, a social system. We want to say that it is not easy, but we are trying hard to give equal opportunities to everyone, and to distribute this health system to the grassroots level, and to make it technologically fit, as Dr. Fazilah said, the IT, etc. We want to implement that kind of things in future.
But Millie, I just would like to add to what Madam mentioned, other than, of course, talking about technology and so forth in the future. I think we must also to have a fresh look at policy making, a policy making process. You know, I'm sure Madam will agree with me. It should be more innovative, participatory. So we already started to use, try to use new techniques, new tools, co-designing, foresight policies, scenario planning. So these are certain things we are trying out now. And these are some of the things which I am driving when we are developing a regulatory framework for the digital health. So I think that is one. And this, you know, this agenda of health in all policies, I think that we have been talking for many years. And I think this is the time to push that agenda, you know, because COVID-19 actually has proven, you know, the health and well-being is not all about health. It's also influenced by many factors, like mentioned by Madam just now: education, living condition, and so forth. So, so I was wondering, how is that post-pandemic socio-economic policies going to be? You know, so that is one area. And also, I think it is also vital for policymakers like myself and Madam here to future-proof the skills development and close the skills gap, you know. So the future is actually have to be between humanity and science. I think that's how it should be. And all our policies or education system, I think, must reflect this. So I think that is how the future is going to go on. It's no more business as usual.
Exactly.
Thank you very much. We have about 10 minutes, and we're starting to have questions come in. One of them comes from our colleague from Nepal, who's curious about how, Madam Minister, this is a question for you. How have you been supported by other ministries? And if you think that a portion of that support has come to you, or you have been able to secure it, being a woman minister?
Yes, the knowledge exchange is the most important thing. We are discussing with others throughout the world, and also we are discussing inside our country with other states, etc. And we are sharing our experience, and we are taking something from each other, and we are making our system more strengthened. And that is the method throughout the world. We should have to open our eyes and look every part of the world, anywhere, what is happening, and is there any positive things happening in any place, and we have to add it to our system also. And we should have our own decision. That is the most important thing. We should have to discuss each and every one, but we should have to decide, and we should have to implement it. Prolonged discussion without any action, there is nothing good out of that. And we should have to decide at once. The decision making at once is the most important thing during the pandemic or any kind of natural calamity or anything, any crisis. We should have to decide ourselves. Don't waste time for taking a decision. But don't take decision as individually or like that. We should have to discuss, and we should have to get knowledge from others, etc. Now Kerala is looking outside, and each and every part of the world, whether we can get any more good system out of that, and we are getting some messages and we are implementing it here. But the basic structure that we have to keep it as Kerala special, as the decentralized method, etc. And Dr. Fazilah also said, Madam is also said like that, we should have to look the grassroots level, and we should have to give them all the facilities, like even Madam said that even the Wi-Fi and even the internet connection, etc. The poor people should have access on that. Then only we can listen to the village through our IT measures or our solution, the artificial intelligence, etc. Without that, we cannot do it everything manually or the old style, you know. That is the most important thing. And we should have to exchange everything, and the world become one. And not only this one, as WHO said, we should have to look for the one health attitude, one world, one health. We should look the animals and other living organisms also. We should have to listen the animal issue. In Kerala, we are addressing the issue of the animals, or the dogs, the birds, whether they are getting eatables or not. we are soothing them also, and we are approaching as one world, one health system.
Very good. Thank you so much. Maybe the next question I point to Fazilah. Question from colleague Amit Kumar. How can governments address COVID impact on vulnerable groups like women, children, lower castes, those which are most likely to get impacted the most?
I think even before COVID, we were already moving towards our 12th Malaysia plan, which is 2021 to 2025. But some of this is already addressed in our SDG goals. I think, but COVID has made it more important to address this. So now we are trying to see all the impacts, a lot of studies being done, and all the impacts on these vulnerable groups, and how to ensure they are not affected. They are badly affected now, but looking into their economic and social well-being. So I think this is already started to be addressed, and it will be part of our post-2020 agenda.
Very good. I'm conscious of the fact that both Fazilah and Madam Minister needs to leave for other meetings in a couple of minutes. We are getting more questions for which we don't have time this morning. But if
I can stay back if you need it, I can stay back.
Very good. So I was going to say, if you agree, we can also send these in a written form to you, so we make sure that we get back to the NextGenGov community that the Regional Innovation Center from Bangkok has been tendering. So maybe just a couple of things from my end, Aafreen, before handing over to you, that have kind of stood out. One, governance cannot be conjured overnight. This is a cumulative investment in human development and various forms of societal infrastructures throughout time that we can tap into. One. Two, crises tend to accelerate transitions. And transformations. We have seen this in case of Malaysia and technology. Even though speed is not a direction, and when done in a pretty hasty way, they can also expose certain potential risks like access and digital gap, digital literacy. Three, the crisis also exposed the need for some of those basic infrastructures and capabilities, from ensuring housing for the poor and the homeless in Kerala, to ensuring access to safe and clean drinking water, but also to creating a different space for a relationship with private sector, one based on shared public values. So I think these are some really important factors that have come out from this discussion. I thank you both very much. It has been a great privilege of mine to speak with you this morning and to hear your stories. Colleagues who have joined in from many different parts of the globe, thank you so much. We have recorded the session, and we will make sure to share this with everyone post-pandemic, post-webinar. And Aafreen, with this, I hand it over to you.
Thank you so much, Millie. Thanks a lot, Honorable Minister, Madam Shailaja, and Dr. Fazilah. Well, we can just say that this webinar was just the beginning of our relationship with you, and we totally look forward to learning and also sharing what we have learned from all the other countries with you. And we really want, to navigate the NextGenGov journey with your support and having you at the driving seat in your respective countries. For all the colleagues whose questions have not been answered, here's a promise we are making from RIC. We'll send the responses back to you on your emails. Thanks a lot, everyone, for attending. And ma'am, thank you so much for spending time. I know you have a meeting with your Chief Minister, so all the best for the meeting, and have a great week, everyone. Have a great day. Thank you so much.
Thank you. Thank you.
Thank you very much. Thank you.
Thanks, madam.